All right, welcome to Parents Anonymous podcast. I'm Tal, and as you guys can see, Rapali's not here today. She's temporarily replaced by Dr. Carolyne Hiebert, who is our guest of honor on our episode today. She's actually our first official guest on our
Thank you.
podcast, Parents Anonymous podcast. So, Dr. Carolyne, she's a specialized in prenatal and children's chiropractic care, just one of the things she does. And she's trained in California over a decade ago. And Carolyne saw a growing need for practitioners to be equipped to take care of infants, children, and pregnant women. So Dr. Carolyne is one of a handful of Canadian chiropractors to have successfully completed the International Chiropractic Pediatric Association's doctorate in advanced prenatal and pediatric care. So congrats on that.
You.
And she's an avid member of the ICPA, a member in good standing of the College of Complementary Health Professionals and of BC, and the British Columbia Chiropractic Association. And she's completed her diploma in advanced pediatric and prenatal care and designation of the DACCP to become one of only 6 practitioners in Canada and one of 70 worldwide, and the only chiropractor with advanced pediatrics on the West Coast. So quite the resume, Carolyne.
Thank you.
We're very honored to have you on our episode today.
Thank you very much.
Yeah.
Thanks for having me. I was honored.
Yeah, thank you. So as you guys know, we've talked about Dr. Hiebert, Dr. Carolyne, as we call her here in the practice. She's been there literally since our daughter, our firstborn, was 3 months old. And then our son's been seeing her since he was about 4 weeks old. And we have a few family members. We have 3 groups of family members.
Yes,
get them in once their child's 4 weeks old. We'll like make that phone call, and they come from like far and wide to come to this practice.
They do drive for a long time to get here.
Yeah. So I was going to ask the first question. What made you specialize in pediatric chiropractic care?
It's a great question. It was all of this feels like a really long time ago. I like to think I'm young. When we were in school in the 2000s in California, in the San Francisco Bay Area, there was so much conversation about adult care, and just there was a void that was happening at the time for women and kids. And so like prenatal and postnatal and then infants and children. And I was like, this is over half the population. And like, how is it so important to be under chiropractic care? And then these kind of least reach groups weren't getting enough attention in school. So then I sought out the ICPA, and they had a presence in the Bay Area at the time, and they were offering courses. And so I started taking courses and getting excited about working with kids and infants. And it more just came out of that. And then the more I did, the more I realized I enjoyed it, the more I thought I'd like to have a family practice. And then eventually thinking, I'm going to have a family of my own. Like, how am I going to take care of them? Knowing that this is an important piece of health. And so that kind of like led me into pediatrics and kids. And then it's also that, adults, we love working with adults, and it's important too to work on adult issues, but there's such an opportunity when you're working with infants and small children that you have this opportunity to change the trajectory of their spinal health and catch things quickly and make sure that they continue to grow and develop properly. So I just thought, like, why aren't we getting ahead of it from birth and early childhood development? So that kind of just triggered me into all of the courses and all of the training. And then I just love working with kids. They're also like way more fun than adults.
Yeah. Exactly. You're like a family member to us. Like you've seen us through like all the holidays.
Yeah.
Like, also like we've known Carolyne for about 3.5 years now. Yeah, because ever since our daughter was born, like a few months, she's been coming here. So I think that continuing care and relationship is very important, not only for us, but our child who knows you very well and knows you by name. And
there's a lot of consistency. Like a lot of the kids in the practice will call me auntie. They'll be like, Auntie Carolyne. And I'm like, I'm not your auntie, but I love it. Like, I'll take it. Like, it's better than Dr. Carolyne. Like, they're just so familiar. And we have the privilege of watching them grow up, which is really cool.
Really cool.
Like some of our oldest kids in the practice are graduating this year. And I'm like,
yeah, it's
crazy.
It's no different than dental care, right? Which is regular, and I'm a proponent of chiropractic care from early on into adulthood and beyond, right? So
yeah, I love that.
So how is treating a baby or child different than treating an adult?
Yeah, totally. I think that's a misconception that often happens when people are referred or people talk about chiropractic care for infants and children. They're picturing an adult getting cracked or adjusted, and they're picturing that on an infant, which would be totally inappropriate.
Hmm.
So basically, all of the training for infants and children is age and size specific. So for babies and small children, 6 to 8 ounces of pressure is just enough to make the adjustment. And that's the same pressure you'd use to press a ripe tomato or push into your eye, like your own eye. So really gentle, really specific. Low rotation is important. So things like high rotation adjustments are not warranted on this group. And also just matching the needs of the child, the parent's preference, and what you see clinically is really important.
Hmm.
So yes, it's definitely that little ones only require little adjustments. Some of the babies sleep through their adjustments. It's so gentle. And so, yeah, we really try to make sure that everyone's understanding that before care and that the exceptions and specific adjustments are made for the children
No, great. And
and patient perspective and their opinions too. So
yeah,
we always consult with the
no,
parent.
exactly. You know, your personality is so vibrant as well. Sometimes I know when Rapali and I have come in with our children, it's like you're talking, and then all of a sudden the adjustment's already been done, and we
Yeah.
didn't even notice.
Yeah,
Yeah,
it's like,
so
oh, okay.
so it is.
Yeah, and
Yeah,
my kids too. I think they're often just like so excited to be in the office and happy, and they're getting aligned, and it just feels good. And it
yeah,
feels good to be adjusted. So there's no like pain associated with the adjustments for infants and small kids. Like they enjoy it. Of course, as children get older and they have more symptomatic complaints, like yeah, we have to address those appropriately, and they can be a little sore after visits. But it's usually because there's something already causing that
yeah.
soreness versus a response to the treatment.
Awesome. Thank you. And many parents worry about safety. Can you walk
Mm,
us through how you ensure adjustments are gentle and safe for
yeah.
children?
We always want to make sure that there's no contraindications for adjustment, whether it's an infant, child, or an adult. So things that would be in their health history that would be something that we'd have to refer out for, or if it's not the right place for their kiddo, we make sure to get them to where they need to be. So a lot of consideration goes into that. So when they come in for their initial assessment and their health history, we go through a lot of those things. So already at that visit, we're making a decision on whether or not chiropractic care is going to be a good fit for the child, or if there's somewhere else they should be instead of the chiropractic office, or if we need to liaison with another health practitioner for co-management or help.
Hmm.
And then from there, we always go through a good informed consent with the parents so that they know what to expect, what not to expect, and how the treatments are going to be done. And then from there, we start. And then we're always following up and making sure that everyone's happy and comfortable.
No, that's great because I remember our first time round. You know, our we mentioned our daughter being possibly having colic and dealing with all that stuff, and
Yeah.
I was not sleeping through the night as she wasn't either, and working full time,
Oh,
and
yeah.
hoping Rapali is doing well as well, being a mother that just gave birth.
Hmm.
So I remember coming into your practice, both of us with our daughter, and just being frantic, and you really put our concerns at
Hmm.
ease and made us feel comfortable, and being a parent yourself, like you've
Hmm.
been there, done that.
Totally.
So having that was great. And I found that our initial consult, you really helped us feel comfortable with what was gonna
Hmm.
come.
Yeah.
And you didn't do treatment right away either, which I think is a big part to let us sleep on it as
Yeah,
well.
we like to make sure that everyone feels comfortable with what's happening. Like when you're a parent, you know, like your child's your most important, like that's your whole life there. And so you want to make sure everything's good for them. You want to have time to decide. There's no pressure. So sometimes we have people come in for the consultations, they have questions, they want to check with someone, they want to check with their doctor, they want to think about things. There's no pressure. We
Hmm.
always say, take your time. When you're ready, come back in and we can start then. So,
Yeah,
yeah, we always want everyone to feel comfortable about what's happening.
awesome. You kind of mentioned this a little bit already, but are there any risks or situations where chiropractic care should be avoided?
You know what? Most of the time, it's if something's like a traumatic induction. Like, so for example, if like a child falls and they have a concussion or they need maybe potential imaging before we start because there could be a fracture or something really serious happening, then we always pause and make sure that we get everything done properly before we proceed because there are some times that it's not the adjustment that they need something else. But for well children that there's not a trauma inducing the injury, we usually are pretty comfortable to get ahead with care.
What are the most common issues you see in babies and young children? Colic, sleep issues,
Mm.
stuff like that.
Totally. Most of the babies that come into the office, I think just because of my history of being here in the Fraser Valley in our practice, of course, when you have prenatal patients, you end up having babies into the practice.
Yeah.
So most of the infants come in for a well check. So the parents want to make sure that they're good post birth. Sometimes there's something that happens in the birth and delivery process that they're concerned about that they want to have a look at after the baby is born. But oftentimes it's just to make sure that they're good to go. Sometimes we have babies that have something really obvious occurring with their posture, like specific head rotation or tilt, or they're not making a milestone or something that the parents are concerned about, like an in-toeing of their feet when they're older and they're walking, or as children get older, they have a trauma or concern, they're involved in
Mhm.
sports. So it can be a wide variety of things that bring them, but generally it's for wellness versus a specific concern.
Okay.
Like all of the parents that bring their kids just want them to be well. They want them to thrive. They want them to have a healthy spine and make sure that they're growing and developing as well as they can.
Yeah. And I guess you're the perfect specialist for that. Have you seen cases where chiropractic adjustments helped with recurring or like with posture problems?
Yes, with posture for sure. So it's always a great idea when children are born to have them assessed for any spinal dysfunction. From there, as you guys know, they make their milestones. So through the first year of life, the spine itself almost triples in length.
Mhm.
They triple in weight, and then they go through all their biomechanical milestones, including their secondary curve development. So the cervical curve through tummy time, the lumbar curve through standing and walking, so making sure that they're well adjusted from early on and then doing well checks to make sure that their posture is good, that they're developing well, and that their spine is free of stress is an awesome idea.
Awesome. And in our case, we've mentioned it with our son, our second born. He was a breech baby, a Frank
Mhm,
breech,
mhm.
where he was essentially pancaked and his toes are touching his forehead. So in that case, we had to take him for ultrasound at 6 weeks.
Yeah, abs-
Yeah, hips, and then we actually saw you like
mhm,
right after that
mhm,
to check it out. Do you
mhm.
mind just saying a few things on that? With
Yeah, it's really interesting. The in utero positioning can affect the spinal structures, and that's why with the breech babies or transverse babies, they usually do the ultrasound for hip dysplasia.
Mhm.
But we always want to take a look too, because further to that, they're physically born. They have their history of time in utero, and especially with things like hip dysplasia, you want to make sure that the lumbar spine's moving well, and you want to make sure that the spine itself, especially when they're folded in the womb like that, is doing as well as possible on the outside because then they get gravity on this side too, amplifying things. So
Yeah, awesome.
it's a good idea.
And this question was about how can chiropractors support children with developmental milestones? Kind of mentioned that a little bit
Mhm,
as an
mhm,
overview, but in more a little bit
mhm.
more detail.
Yeah, it's children make their milestones on their own kind of trajectory. We have 3 kids and they all made certain milestones at different times, right? Like our oldest started walking at 9 months unprompted. Nobody was
Wow.
encouraging that. And then our middle was like 12 months, like I think it was on her birthday.
Yeah.
And then our youngest, who we thought was going to be the fastest to walking, ended up walking at 16 months. And it's like, okay, like, come on, buddy, let's go.
Yeah.
But they all do it at their own time frame. So instead of fixating on time frames and dates, we want to just make sure that there's nothing prohibitive for that child making that milestone.
Mhm.
So as long as the spine is moving, their pelvis is moving, then there's nothing preventing normal motion occurring. So
Yeah.
when they're starting to sit, when they're starting to weight bear and stand, when they're falling on their tailbone, when they're starting to crawl or engage, we want to make sure that the whole spine is moving as well as possible. So that's not the reason
Yeah.
that they're not making that next milestone, because all of the milestones biomechanically build on each other.
Mhm.
So as they start to get their head and neck extension, that starts to move into rolling. And so like each one builds. So if you can't make the first milestone properly from a spinal standpoint, it
Yeah.
can really cause a cascade event where
Yeah.
they start
Just
to
dominoes.
lose a little bit of that steam. So we want to
Yeah.
make sure that on well checks, they're coming in, we're looking at their spine, we're making sure they have adequate and good function, and then they make those milestones when they're
Perfect.
here.
Do you have a recommended like typical frequency of those visits?
Yeah, you know what? It's always different per child because everyone holds their alignment a little bit differently. Sometimes some babies and children will need more care at the front end, depending on their birth history and how they are functioning. From there, kind of 4 to 6 weeks is a nice interval. Some kiddos can go out to 8 weeks. Some kiddos have to hug a little closer to the 3 to 4 week milestones, or 3 to 4 week checks as we're doing milestones. As children get older and they develop their lumbar curve, once they're fully standing and walking, then we can spread out the visits a bit more because
Mhm.
they're not going through so much spinal development and they're often having less trauma from learning how to
Yeah.
move. And then sometimes, too, as kids get into activities, we have some kids in the practice that do high level hockey or high level
Yeah.
gymnastics. We have kids on Team Canada for dance, and it's like
Wow.
those kiddos are pushing their bodies to the limit. So, like, yeah, they're not on 4, 6, or 8 week frequencies. They're in sometimes weekly or every 2 weeks, or as needed if they have a trauma or injury happen. So it really depends, but it's person specific, and that's what we like to do is make sure it works for the person for what they need and how they can benefit.
You mentioned, hold their adjustment.
Yeah.
Yeah, for our viewers that might not know what that
Yes.
means.
Yes, totally. I know there's so much chiropractic going on. Holding an adjustment means that your body is staying in good alignment and good function for a certain period of time.
Mhm.
So sometimes when you're starting chiropractic care, your body needs more frequent adjustments because we're trying to retrain a neuromuscular pattern that has either been there for 30 or 40 years if you're an adult, or
Yeah.
it could be, days, weeks, or months for kids. And then once things are functioning well, then we can increase the length of time between visits because those visits will hold in functionality for a longer period of time.
Yeah.
So that's what we mean by like holding.
Holding adjustment.
Mhm.
Yeah, I think as a new parent or even a experienced
Mhm.
parent, I don't think you get the full experience,
Totally.
ever, but, I feel like, those milestones, we get so, like, focused on
Fixated.
them and
Yeah.
fixated that even, like, our son, he just started rolling over and he's almost 15 months, and
Hmm.
he's went to crawling first, sitting, like,
Yeah.
quicker. So
Yeah.
I think having, Dr. Caroline kind of
Mhm.
be that comfort and that ease for us, like, it was nice having
Thank
someone with
you.
a background, in a specializes.
Well, and it's really interesting because in the years of practice that I've had, we've had so many encounters with different families. We have children with all kinds of different needs. We have children with all kinds of different histories. I think we've seen probably the most different variety of kids in the office. And it's so awesome because that breadth of knowledge goes between all the patients. Obviously, we're not talking about specific cases, but you're like, no, I had a patient where this happened and this is what we can do to help. Or like, I know about this. Or like, we
Yeah,
had, I think it was my first year in practice, we had a child and he wasn't walking till 19 months. And I was like, okay, like, even for me, this is long.
yeah.
But then since we've had kids at 20 months, 21 months,
Wow.
22 months, and like they're great, they're doing fine. So
Yeah,
you start to get that perspective where you're like, okay, not everything is cookie cutter.
yeah,
This is what we've seen in clinical practice. This is the breadth of knowledge that I have. And of course, consulting with their family doctors and other people are involved too. But it's like you have a background where you're like, no, it's going to be okay. Like,
yeah,
I know this is going to be okay for
yeah,
you, or this is how I can support you. So
yeah.
it's kind of cool. And then having your own kids, you like see your own experience. You're like
Yeah,
9 months, 12 months, 16 months. Like, it's crazy the
yeah.
variation that occurs with
It
kids.
is, yeah.
So,
Our daughter started walking just at 13 months,
yeah,
and our son now being 15, he's getting close, but he might be
yeah,
like your third
yeah,
one as at
totally.
16 months. But not only that, you bring that chiropractic background, but also that being a mom, a
Yeah.
parent. I remember when our daughter, she was teething, but you told us before we knew by showing us some of those, and that's not even from your schooling. That's
Yeah,
just being a parent and
yeah,
being experienced with
yeah.
multiple children, like
Totally.
parents.
Yeah, you get that experience for sure. And yeah, it actually brought a different kind of perspective to me, even in practice, because I practiced for many years in the pediatric realm and the prenatal realm before I had my own kids,
Hmm.
and went through my own pregnancies. And then you go through it yourself and you're like, okay, this is like a different perspective that
Yeah,
now I can bring and be like, no, 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 no. I remember that when I was pregnant, or
yeah,
yeah, this is what I did, or like, this is what I did for my kids, or oh, I totally understand this, or this is a teething baby, or like,
yeah.
it's just, yeah, it's been actually really awesome. We have a lot of community here in the
Perfect. Yeah, and I find like you have a lot of different cultural backgrounds come in
totally.
too, and trying to educate them
For
as well.
sure. I mean, we have, yeah, tons of different cultures and different people groups in the practice. And so it's interesting because anyone who's come to Canada, who's come from different countries, some of the countries have chiropractors there,
Yeah,
some don't. So some already have an experience. Some, this is like first experience with chiropractic, but that happens for people that have been born in Canada too. And they're like, I've never been to the chiropractor. And I'm like, how have you never been to the chiropractor?
yeah, yeah.
like, it's like so cross-cultural that chiropractic is such a great modality. And so, yeah, we've been having a lot of fun educating and trying to meet people where they're at and educate them to their full health.
Oh, great. And I find when I originally, stumbled upon your practice, being that desperate, lack of
Oh, yeah. The
sleep
sleep
parent,
deprivation.
sleep deprivation, I find that there wasn't a lot to like find online. If
No.
is it something that's it's still being researched, or is there more
Mm.
literature coming out? And
You know what? It's always, yeah, that's a great question. When we moved to the Valley, whatever, 16 years ago, this was like I was the first person in chiropractic working with kids as a point in practice. There's of course lots of chiropractors that were already here adjusting kids, but it was part of my mission being in the Valley to educate and try
Mhm.
to bring awareness to kids and families being under care, prenatal care, postnatal care. So there was already chiropractors doing that, of course, and chiropractic has been around for over 100 years. It's not a
Yeah.
new profession, and adjusting kids is not a new concept. But I do think the idea of proactive health is just something that we're seeing more in the last decades, right? Like when I was a little kid, I still go to the dentist regularly, right? Regular dental hygiene was educated for our parents, and then we started going. A generation or two prior to that, they probably weren't going regularly, or only if they needed a tooth pulled or something really severe had happened. So the idea of proactive health is important. We recommend people go get their eyes checked at the optometrist from 6 months on. Babies
Mhm.
can go get their eyes checked. And so I think people are getting more and more aware of how health is important from the beginning, and that it's not just coming in at the end when there's symptoms or an issue, but to proactively make checks. So,
Yeah.
yeah, I think 16 years ago, you would have found less information in this realm. Now, for sure, more. And then there's a lot of differences in the different countries. America has a lot of pediatric programs and education. That's where I did a lot of my training. New Zealand,
Yeah.
Australia as well. Canada's getting there for sure, but like it's different by country too. So
Yeah.
sometimes you see that.
Yeah, like, what about some of those new students or that
Mhm.
might be in, chiropractic school, get their doctorate?
Mhm.
What would be some advice to them if they're maybe thinking about going into
Mhm.
pediatric as a
Mhm.
specialty?
Yeah, I think, yeah, that's a great question. For a lot of the chiropractors that we know and have connected with, sometimes they'll come shadow. So, shadowing a pediatric practice or a chiropractor who likes to work with infants and children is a great idea, because then you actually get to see what it looks like. It's just like with anything, sometimes the theory of it sounds more glorifying than actually doing it. In this case, I actually just think it's a great career. But yeah, having them come to an office to check it out and see what it's all about is probably a good idea. There's a lot more pediatric clubs around chiropractic that'll help and get you connected to
Mhm.
training and specific events as it relates to chiropractic with kids. And of course, the school training is good too.
Right. And my last question is about the moms, you guys, the
Mhm,
most important people. Any recommendations for prenatal and postnatal
mhm,
care for a mom?
mhm. Yeah,
Like when to start
yeah,
and
we always love it when our moms are under care actually before they end up conceiving, because it's like their spines are healthy and
yeah,
already functioning quite well. But the prenatal period is so important because already with conception, you get relaxin, and that creates ligament laxity in the joints. So that alone is a big reason for having chiropractic care in pregnancy. 'Cause even when a mom's not showing, their body's changing so
yeah,
rapidly. And then, of course, everyone can conceptualize that as a baby grows and the mother's body is physically changing so much, just having those adjustments is really healthy for the spine. It's like the percentage of women with low back pain and sciatica and rib pain in pregnancy is just, it's just a lot. And
yeah,
so because women all go through the same biomechanical process, though they all have different health histories,
yes.
they all have typical and similar concerns. And so chiropractic care can really help make a good foundation for healthy pregnancy.
Mhm.
And then postpartum too, the body changes so much, like, right, the relaxin's dissipating, but we've got new postures. We're holding and rocking a baby, we're
Yeah,
feeding. So again, supporting the mother super
yeah.
important. So yeah, we love to do that too.
Nice. So not only will you be treated physiologically, but also I feel like Dr. Caroline's great for conversation and just to bring new parents to ease. Like she just
Yeah,
has that vibe about her.
thank you.
Thank you so much for taking part in our episode
Oh, I
today.
love that. Thank you for having me. It's
Yeah.
an honor.
So it's Dr. Caroline Hiebert from Pacific Life Chiropractic Care here in Abbotsford, British Columbia. She's not the only practitioner. If you're an adult looking, she or others here, there's RMT and other services. check them out. We'll tag them and put a link into their website as well. Thank you
Yeah.
so much.
Thank you. Thanks for
Uh,
being an awesome supportive
Yeah.
chiropractic care.
Yeah, thank you. And we'll catch you guys on the next episode. Bye.